Hi guys, I'm just holding on for more people to join us so we can start off what we are doing. So we can start off today's program. You can Onyi, how are you? How are you, my love? It's been a long time I've seen you. How are you? Yes, welcome. I want to welcome everyone. Yes. I'm just holding on to see for more people to join us for today's broadcast, okay? By the way, how are you? How was your Christmas celebration? I hope it was a good one. Yes, today we want to see if we can learn today self-breast examination, how to perform your self-breast examination. So I'm just waiting for more people to join us so that we all can learn today how you can do and perform your own self-breast examination. Hello, hi, hello, Maros, how are you? Sister Bridget, I was just thinking about you today, honestly. I'll call you. Yes, I'll call you. I was talking about you today with my husband. I'll call you after this. Yes, I'll call you. So, basically what we are talking about today is self-breast examination, how you can do it. Many people have heard about self-breast examination, but they don't know how to do it themselves. So today I want to teach us how you can do your self-breast examination. You can invite your friends to come and join us. You can invite your family to join us to learn how to do their own self-breast examination. That is basically what we want to do today. And for some people who are joining me today for the very first time, my name is Mrs. Uzoamaka Nanakwanta. I am a mammographer, a trained and certified mammographer. And I'm here to help us to fight breast cancer as African women. Hopefully, we'll win this battle someday. For a start, I want to tell you, in case you have any questions concerning your breast health, anything about your breast, please feel free to ask me in the comment section, or you can send me a personal message. By the grace of God, what I want this video to achieve is for someone to know when to be able to detect when there is a problem with their breasts, and for that person to be able to get quickly to the hospital to know what she can do about it. Now, before I go into the self-breast examination, I want us to give a little recap, okay? So it's not everything that you find out on your breast that is a problem, okay? So it's not every lump that is a cancer lump, but it is very important that once you find something, that you go to the hospital. It's very, very important that you go to the hospital and let the doctor check you out and either confirm or dissuade your fears. Before I go on to teach today's self-breast examination, I want to tell you about someone. The last time I told you about a lady that met me, and she was happy that she asked for help. Not too long ago again, while I was working, I still met someone else who came in, a lady, And she was quite young. She was quite young, and she felt a lump on her own breast. And this is where this self-breast examination comes in. She found it out herself. That's what I have come to encourage us. So she came to the hospital and said that she has found something on her breast and she wants to check it out. That is exactly the proper thing to do when you find a lump on your breast. She came in, and fortunately for her, of course, the moment you come in, we are going to do, in the hospital, the doctor is going to do what we call clinical examination. So it's the doctor that will check you again and do a more proper, more professional examination of your breast, physical, to know if what you are saying is there is really there. And after that, he will send you for a mammogram. And if there is need, he's also going to send you for an ultrasound. And from there it goes on. Okay. It's either you need a biopsy or you wouldn't need a biopsy, or you are really totally fine. What is found in you may just be a benign mass and nothing serious, and you will be sent and you will go home. So this lady came in and she told me that she really honestly wants to tell me she never knew that breast diseases can occur in people who are young. She never knew that someone under the age of 40 can have breast issues. And I told her that yes, it is something, it's a misconception. Many people think that breast cancer only occurs in women that are older. As a matter of fact, many people actually think that breast cancer occurs only in women. But that's not true. Men also do have breast cancer. So I really, really want to encourage us to, as much and as often as you can, especially after you've seen your period. Hello. Yes. Yes, we are just holding on for more people to join us before I go into the nitty-gritty of self-breast examination. I'm trying to hold on for more people. Hello, Jude, what's up? Oh, my darling husband. God bless you, sir. Cynthia, what's up? You're welcome. You're welcome. Yes, you can invite your friends or your family members, anyone you think that this lesson or this lecture will benefit. I would encourage you to invite them. So we are just waiting for more people to join us. We are not going to take too much of our time. In less than 20 minutes, we are done with this. But I pray that by God's grace that it will yield good fruit, that people will really, really learn and use it. So that when you are at home or you travel back to the village and someone says something about her breast, you'll be in a better position, from an informed position, to advise the person on what to do. So we are just waiting for more people to join us. We are just waiting for more people to join us. Exalt his name. Only him deserves your worship. Yes, and if you have any question, like I said, please don't hesitate to ask me. I'm happy to answer your questions, anything concerning your breasts or something that you've seen. I was telling you about that lady, okay? Eventually, by the time she did her mammogram, because here in the UK, we do mammograms only on ladies who are 40 and above. And this lady was less than 40. She was about 36. And she came in after the doctor had done the physical examination. They found out that she needed an urgent mammogram, even though she wasn't up to the age. But the doctors are certified to ask for a mammogram when they think there is need for it. When what we call the benefits, when the benefits outweigh the risk of radiation. And then secondly, something else, some other reason why we don't do mammograms on younger ladies, mainly because they've got what we call glandular tissue. Okay, so their breast tissue is more glandular, and glandular tissues make it very difficult for doctors to interpret breast x-rays, which is what we call breast mammogram. So I'll try as much as possible to be as how would I say it, as simple as it is, using simple terms, because I want everybody to understand what I'm saying. So when I say glandular tissues, they are not fatty yet. The person is still a strong, the breasts are still strong, the person is still young. So those type of breasts are very difficult to interpret in mammography. But breasts that are already fatty, so usually when women begin to get to the ages of 50, 60 downwards, you find out that the breast tissue gets to become more fatty than glandular. And in such cases, it's a lot easier for mammograms to be interpreted more correctly. So she had to be asked, she was asked to go and have a mammogram, even though she was a lot young, because of what the doctor had found out. So we did an ultrasound first for her because of her age. The ultrasound now showed something not very nice. The radiologist was not happy with what he saw. So he did a biopsy and inserted what we call a clip. This clip is just to show that something has been done in this part of the breast, so that it will help whoever or wherever the part of the world that person goes later. Anybody that does a mammogram on that person will know that something was done there, a biopsy was done. So after that clip, she had to come in for a mammogram. The mammogram is used usually to know where the clip is and be sure that it's in the right position. So you see, coming to the hospital was the best decision that she could make. She made a very, very good decision by coming to the hospital. So I really want to encourage us today. Hello. Hi, Ify. Ify, you are welcome. You are so welcome. I welcome you. We are still waiting for more people to join us. But as we are waiting, if you have any question, please, like I said before, don't hesitate to type down your questions, and I will do my best to make sure that your question about breast cancer is answered. Yes, let's just give them like 5 more minutes for anyone else. I really want to apologize for not coming on air exactly the time that we planned. This was due to many things, honestly, but I hope more people will join us, as many as can. If you can invite your friends or your family members who are females and males. Like I said, it is beneficial to everyone to learn what we are about to do today. So I really want to encourage you to invite your friends before we start off. Okay. I think we should just crack on. We should crack on. We have barely 30 minutes. Like I said, between 20 and 30 minutes we should be out of here. Okay, let's do it. So for your self breast examination as a woman, let me organize myself so that you understand what I mean. You can actually practice it as I'm doing it wherever you are. You can do along with me, and I believe that will help you to understand what we are saying. Okay, so the very first thing that you are required to do is to stand with your hands on your waist in front of a mirror. Now I always suggest that we do our self-breast examination when we are taking our bath. I always suggest this because when you're taking your bath, you have soap and water all over your body. so it is a lot slippery, and so it helps you to really feel. Okay, so I always suggest that you do it when you are taking your bath. That's the easiest, quickest time, just in case you are not so ready to take all the time or to remember to do it. Just remember when you are taking your bath. And before I start, the best time to do it as a woman who is still menstruating is to do it about 6 to 7 days after your period. Now, we ask you to do it at this time because it is at that time that your breast is less bumpy. Usually for many women, when they are menstruating, they tend to feel that their breasts are not as it used to be. It's a bit more bumpy. So in order for you not to mistake bumpiness with an actual something going on, it is safer to do your self-breast examination about 6 to 7 days after you have finished your period, or after your period had finished. Okay, so having said that, like I said before, you have your 2 hands on your waist. That's the first thing to do. When you have it on your waist, then you turn around. What you are doing now, remember you are standing in front of a mirror. You do your self-breast examination standing in front of a mirror. And so you turn to look. While you are turning, you are actually looking at your breast. Okay? So you look at your breast. When you are looking at your breast, these are the things you want to know or you want to see, okay? You want to check if your breast is still looking the same as you know it. Like I said earlier on, even in my former video, my last video, I said the main points for self-breast examination is to know your normal. Knowing your normal will help you to know when there is something abnormal. But first of all, know your normal. Okay? So knowing your normal is the first thing to do. Okay? So you have, with your hands on your waist, you are looking out for anything, any changes. Are there rashes? Is your nipple out, or is it in? Is it drawn in? Is it the way it used to be? Are you seeing some redness in some parts? Or are your breasts just the way you know it to be? So when you have looked at your breast very well, can you see that? So you just turn to look at your own breast. I also say that it is good to do it when you're taking your bath because it also affords you more privacy. You will agree with me. There are so many people who are really shy. Even as married women, many women are still very shy. Okay? Now I understand that. So doing it in your bathroom also affords you that privacy. So you are able to really check through without feeling someone is looking at you or someone is judging you. Or so I still recommend you to do it when you are in the bathroom. Okay? And so after you have looked at your breast very well, remember what I said, you are looking out for bumps. Remember, some of them you can actually see. Redness, rashes. Is your nipple in the way it used to be? Is it still out or is it drawn in? These are the things you are looking out for. Okay? Like I said, try to invite your friends if you can, just to join us, and I'm sure they will benefit. Okay, so after looking at your breast, I will also ask you to use the pads on your these three fingers. You see this pad here? I always ask that we use this pad. One of the reasons why I ask for this pad is that these pads enables you to depress and feel deeper into your breast. Okay? So you remember that when you are feeling your breast, you are using your brain. Okay? So mentally, even with your eyes shut, I don't know, those of us that are in medical class, like when we were in anatomy in UNN, UNEC. So usually when they want to teach us how to feel the pulse, sometimes they'll ask you to shut your eyes and just feel it. So you have to activate the inner sense that will help you to feel that yes, there's really something going on. So just that, in that same manner, you can actually, even if your eyes are shut, you can, with those 3 pads, feel round your breasts. Okay, I always suggest that we go in a particular pattern first. Now, why I say go in a particular pattern first, okay, is so you don't miss out any part of your breast. So I always suggest that you come all the way up as high as you can, okay? And the best way to do it is to do one breast at a time using the opposite hand, okay? So while you have this other hand, you check for the opposite breast, okay? You can even have that hand down still on your hip, and you begin to feel all the way from your scalp, from your clavicle, I beg your pardon, from your clavicle, you begin to feel all the way down. And as you are going, you are making a conscious effort. Remember what I said about closing your eyes? You can actually close your eyes. The main reason is you really want to feel what's going on inside of your breast. Like I said, you are doing it majorly with these 3 pads, okay? The pads of these 3 fingers, okay? So if you can go round, remember where you have gone. Why I always say go clockwise, okay? Or anti-clockwise, whichever you choose first. But no, you will do the opposite of it eventually. So when you go that way, remember you are starting from here. Many people don't know that we start from here. Because your breast tissue, have you ever seen, you see some people that their breasts actually come up very, very high, right? Yes. So depending on the type of breast, we have different shapes and sizes and everything. But basically, know that you must start all the way up from here, okay? And then you go down, go by your side. Like I said, you go round your breast. So wherever you end, remember where you have ended. So this is your own body, okay? And you go round again. As you're going, this time, as you're going into the breast, you press in more deeply. Remember, you are using your inner mind to see what you are pressing because you are feeling it. Now, like I said, when you have felt all the way, you get to the nipple, we advise you that when you get to your nipple, that you give it a gentle squeeze. We say gentle squeeze because you don't want to make yourself to cry. You do a gentle squeeze. What is the need for the gentle squeeze? The need for the gentle squeeze is to check if your breast is oozing out any type of fluid. And if it is, peradventure you are not breastfeeding and you notice any fluid that is not breast milk, obviously. And especially, we tell you, any fluid that is bloody, any bloody discharge from your breast, from your nipple, please go and see your doctor. So by the time you do that, you also do the same thing with the opposite hand on the opposite breast, okay? And after you've gone round on that, remember that you are still sitting up, okay? I will also suggest that after you have finished this, that you lie down flat on your back and go again. Going even under your armpits. Just all the way down. Making sure that you go around the whole breast tissue. Many times, I say there is no definite pattern to go about checking your breast. You make your own pattern, okay? Make your own way. How best do you want to check it? The important thing is to make sure that you check it. Remember, Your self-breast examination is not the only thing that will give you a diagnosis. You are only finding out and then going to report to a doctor who will do a better, more professional physical examination. Then combining the doctor's one with your one and the one that the mammogram that you're going to do and other investigations, then a diagnosis will then be made. So do not panic when you find anything while you are doing your self-breast examination. Remember, like I said, not all lumps are cancers. There are many of them that are benign. When I say benign, I mean they are not cancers. There are so many other ones that are not cancers. So I want to encourage us, okay, to do this self-breast examination. After you've done these ones that I talked about, please, I will ask you to lie down. It will be good for you to lie down on your back and do the same thing again with one hand up, okay? So when you're lying on your back, you have one hand raised and then you have the opposite hand again going all the way, searching for anything at all. Like I said again and again, please ensure that you know you're normal. This is the main reason for your self-breast examination. Thank you so much. Oh, Joy. Joy, you're my madam now. Already, thanks, love. Thank you so much. Yes, thank you. So, like I was saying, okay, the important thing is that you know you're normal, okay? When you know you're normal, it will help you to show you that there is a red flag whenever there is an abnormal thing. Like I said, what brought me to do all these things? I asked God if I should go ahead, and I believe I got an affirmation. I got an affirmation because I recently, not too long ago, I lost a young cousin. Like I said before, she was only 40. And I felt that if only she had known that when she initially found that little lump in her breast to get to the hospital, maybe, just maybe, it's only God that knows everything, but maybe she would be alive today. And that is what has made me to come out to teach, to see how I can help in my own little way, to teach people to please take it seriously. Breast cancer is not just for the old. It happens even to the young people, especially the African Americans and Africans generally, the black-skinned women. I ask you, I beg you to please take it seriously. Teach your friends. Like I said, you can share this to your friends and make them to come on, or you can teach them. Teach them at home. When you get home among your friends, teach them to do the self-breast examination. Like I said, when you are menstruating, the best time to do it is about a week after you have finished your periods. That's the best time to do your self-breast examination. And then after, if you are post-menopausal, okay, that is, if you are no longer seeing your period and you're an older woman, okay, then the best thing to do is to choose a day that you want to be checking your breasts. You can mark it on your calendar. You can set up an alarm that will wake you up every first of every month. Just choose what is convenient for you. First of every month is a good idea. That first, when you're taking your bath, you make sure that you do your self-breast examination. This is very important. I am sure that even if you have not seen, you must have heard of someone who had died of breast cancer just not too far away from you. This is to show you that it is real. Please, breast cancer is real. And I want to beg us, we are children of God and we believe in God and we know that God can do all things. And I'm sure that God has enabled us to learn these things, and then to bring it to other people. So I am begging all of us to please do your self-breast examination. Again, it is not the only thing that will show you that you have breast cancer. I have not said that. When you have done your self-breast examination and you see something unusual, please proceed to the next step. And that next step is to see your doctor. Your doctor will lead you and guide you to the rest of it. You may be sent home and said nothing is there. Or you may go ahead to have other examinations. And if eventually, God forbid, but if eventually it is breast cancer, you're going to have a simpler procedure. The surgery for it will be simpler. And the cost also more cheaper. Will be cheaper for you. More cost effective. So I really want to encourage us. The key to breast cancer is early detection. Your ability to detect it early enough makes all the difference. So please, I want to encourage us. So when you lie down, like we are talking, I'm at the point of lying down flat on your back. So when you lie down straight on your back, lie flat, okay? So when you lie flat, we call it supine. When you lie flat, then you have these hands still outstretched, okay? Then with the opposite hand, like I said, opposite to the breast you are dealing with, okay? Then you begin to feel your breast. Okay, I have a question here. Yes, Uju is saying, what are the predisposing factors? Oh God, yes, that's a very nice question. I actually said I was going to do that in subsequent videos. I intend to do the predisposing factors, but I can give you some of them right here and now. Now, one of the predisposing factors of breast cancer is that you are a woman. Being a woman is already a factor. So many times people think it's only when it is genetic and hereditary. Yes, there are hereditary factors, okay? So when you have your mother had breast cancer, or your cousin from your mother's side, so usually we have what we call, we draw a family tree to find out if you have a family history of breast cancer or ovarian cancer. Now, these two cancers usually walk hand in hand. Okay? They have a lot of things in common. So usually if there is someone in the family who have had ovarian cancer, then it is good that you are checked, or you stand a little higher chance of having breast cancer in that family. Okay? So we also have other factors. We have obesity. We have things like diabetes. Diabetes is a predisposing factor. Lack of exercise, it is a predisposing factor. Now, having children very late. Some research work said from the ages of 36. Some research work said from ages of 37. But usually, the point is having children at later ages also is a predisposing factor to breast cancer. Alcohol. Taking alcohol is also a predisposing factor. There are so many factors that predisposes you. There are also some foods that we eat, edibles, things that we consume, that predisposes one to breast cancer. So I will tell you, like I said before, I'm going to do a video solely on predisposing factors to breast cancer. But I can tell you very quickly that if you can cultivate the habit of healthy living and cultivate the habit of being active, okay, not taking your health for granted, just being active, doing your exercises, eating right, your vegetables and your nuts are your friends, then you stand, of course, you stand a greater chance of not coming down with cancer. This is what research has told us. Like I said, there are so many other factors, and I'm going to make it, it's going to be a full-blown lecture, okay, about predisposing factors, what kind of foods you can eat, what you do not have to eat, what you can do, what you don't have to do. But I can tell you here and now that healthy living is key. Healthy living is key at any time. So you can help yourself by not being obese, by being more active. Places that you need to use because sorry, apologies to Igbo, but places everywhere you simply wear up the thing and burn the car. So those kind of things, if you can keep help yourself to be more active, exercise more, is definitely going to help you with breast cancer. Okay. I'm sure that there are so many other questions that are in the minds of so many people. Okay, but I want to make sure that we live with something, and that is that we know what we can do and what to look out for when we are doing self-breast examination. And like I've said, first of all, you will perform the sin of lookery. So you look first with your eyes, of course, your top and your bra off, standing in front of a mirror with your hands on your hips. So usually I say you pull down your shoulder. So you drop your shoulder forward like I just did, and you look at it, and you take it back and you look at it again. So you are looking this way to make sure that, are you seeing any redness, red patches, boils? Somebody was telling me the other day that so I was telling that person about this thing, trying to help people to be more breast aware and everything. And then she told me something. She said, do you know that somebody in their house, in their yard, this is in Nigeria that it happened, somebody in their yard found a boil on her breast. Now, there is nothing like boil on your breast. Any boil on your breast, please quickly go to the hospital, okay? So there's nothing like, hey, ochabe, happy akocha, teya engine oil, teya fuel. Teya, there is nothing like that. The moment you see anything on your breast, please, go to the doctor. Let the doctor be the one to tell you, okay, it's nothing, go home. But as long as it is on your breast, not your hand, on your breast, please go to the doctor. And so she said that there was a boil on the woman's breast. And then, of course, like our normal Igbo people, they said, now we to Torianara. And she say, happy. I said, no, chabe. Every morning, she will come and look at it. Apia. I said, no, chabe. Eteya engine oil. Eteya, eteya mano. She chose mano juku. Kete no ne akocha. They kept doing this. So at a time, only God knows the type of the Amoma people that did Amoma and said this thing that only her husband can heal her. That her husband should be urinating on top of the boil every morning. First urine of her husband that is going to cure her. Hey, people of God. They kept urinating on that boil, on that woman. The more they are doing it, you and I know that the problem with the breast cancer is that it spreads quickly. Okay? So it continued to spread. And this was going on for months and for months and for months. Eventually, this poor woman, the thing had degenerated. Of course, it had degenerated. It had spread all over her body, her lungs, every part of her body. It had gone bad. So by the time they now remembered to bring her to the hospital, of course, it was too late. Even a total mastectomy could not save her. And she eventually, of course, she died. Now, this is a very sad story. And this person told me this thing happened real in her place. It happened. That woman died for nothing. Because someone went and gave a bad prophecy of a bad amoma. Only God will judge all of us. So it is only God that will judge us. Because me, I don't know the truth and the lie. So I want to really, really encourage us. Please, let us not be blind. And let us use what the good Lord has given us. For he said he has given us all things, all things. So this science, the doctors, the nurses, the mammographers, they were all given by God. The things that we are learning, they're all given by God. So I really, really want us to, please, let's use what God has given us. Let's enjoy it. So if you have any problem, please quickly go to the doctor to find out what happens, what is going on your breast. Like I said, I'll be doing other videos. Apart from looking, so when you are feeling, when you are feeling with those parts, your fingers, what are you looking for? Again, you are looking for bumps. You are looking for skin thickening. Thickening. When I say thickening, you know oroma, orange. So when you get an orange, if an orange is getting spoiled on one side, you know how it feels. It feels hard, and it feels hard, and it feels, when, you know, oh my God, how do I explain this? Oroma. Sorry for people that know Igbo. Sorry. So orange, if you get an orange like this, and it's getting bad one side, maybe you came to buy an orange, that side that is getting bad, it feels hard. Do you understand? It feels hard. So that hardness, that place that is feeling hard, that is what we call thickening. Thickening. So all of a sudden on your dear boobs, you just find that there's a place that is thickening like that, or that is hard, and it was not there before. It is a new development, okay? Then you need to go and see the doctor. It is one of the things that should make you see the doctor. If you also see rashes, so you see that there is redness, there's rashes on any part of your breast, please, it is also a good reason for you to go and see your doctor. I have talked about having fluid gushing out of your nipples, especially when you had not provoked it to, you have not stimulated your nipple to bring out anything, and that fluid is pouring out. Like I said, especially bloody fluid. Please go and see your doctor. And even when you press upon doing self-breast examination, and you press very gently on your breast, on your nipple, and you see bloody discharge, please go and see your doctor. So if you also see what we call dimpling, you know the dimple? Sorry, I don't have it. Okay. Yes, something small like this, my small one. But you see that dimpling, I mean dimple like this. You know when there's a dimple. So when there's a dimple on your breast that you have never seen before, it wasn't there before, a dimple, please know that you need to see your doctor. Like I said again, it may not be anything. Mana, okamma, it's better that you go and find out and there is nothing than that there is something and you did not find out early enough. So I've said things like dimpling, thickening, your nipple oozing out fluid, especially bloody fluid. I've said things like reddening or rashes. I've said things like what we call boil. Etuto once if etuto mona bugo. Yes, saying etuto toria. Etuto toria. Etuto obuna torugi nara biko. We'll also go and meet your doctor. Any otuto on your breast needs to be checked out by the doctor. So with these ones that I've said today, I trust and I believe that you've gotten something today. You are living with these points, okay? First, you need to know what your normal breast looks like. I don't care what age you are, whether you are young or old. It is very important that you know your normal breast tissue. What does it look like and what does it feel like? Okay? So, secondly, when you are looking, what are you looking to see? You are looking to check, I am recapping, okay? You are looking to check, is the nipple inside, is it drawn in? Is it inverted? If it is inverted, was it not inverted before? You are checking. Remember, when you are looking, you are checking. Are you seeing any bump? Something bumpy, like a boy, like a tuto? Are you seeing it? These are the things you are looking out for, okay? Even when you are now feeling, you are feeling. Are you feeling anything? Remember, may be normal for you. That's why I said, know your normal first. So if you have always had kind of breast, so you know it is normal for you. But if you've never had a particular, and you just felt a particular one, which is just there, and it is immobile, you just notice that it is there, it is there. Whether you are lying down, it is there. You are sitting up, it is still there. You can feel it. You feel that there is something roundish, okay? You can feel it like a ball inside of your breast. Please go and check it out. Like I said again, it may not be anything, but please check it out, okay? So if you see anything like that on your breast or boil on your breast, and you see dimpling, if you see something like dimpling, like I said before, dimpling like this in your breast, also check it out. Again, do this between 6 to 7 days a week after you have finished your period. Do it 6 to 7 days after you have finished your period. And in case you are post-menopausal, that is, you are no longer seeing your period, then choose a day, a calendar, a day of the month that you will be checking your breast. You can choose 1st of every month. You can choose 2nd of every month to check your breast. And set up your calendar, a reminder on your phone to just remind you to check your breast. And you can also have a click. You can have your breast click that you would remind on that same day. Nne, have you checked your own breast? I've checked my own. No. And the person will check their breast. You are saving a life. Remember, that is the main thing. We want to save our dear lives. The life of an African woman is too precious. So please, I really, really want to thank you all. I thank everyone who has logged on today. Bernice, what's up? How are you? Thanks, Uju. Thank you so much. Onyeka Wakalo. Onyeka, how are you? Oh, thank you so much. Thank you so much. So please, I am really encouraging each and every one of us to try. If there are other questions you still have about your breast, like I said, I'll be teaching the predisposing factors in subsequent videos. But if there are other questions that you think you want to ask concerning your breast, please let me know those questions. Send them to me on a private chat. You can send them in the comment section. I will do my best to answer you. If I don't or can't answer you, I will direct you to appropriate quarters. I still repeat that. I am a mammographer and I come across these women on a daily basis. So I think it is good and wise that I also teach my own people what they can do to help save our lives. So I want to thank everybody that had logged on today. I really, really, really want to say big thank you. And I hope you have learned something today. I hope that you have learned how to do your self-breast examination by yourself. Remember, there is no particular strict pattern. The important thing is that you know the feel and the look of your breast, so that when there is something wrong, you'll be able to pick it up immediately. Till I come your way again, I remain Uzo, the wife of Nana Nkwanta, a mammographer who has chosen to help in her own little way to save the lives of African women. Thank you so much for logging on today. Thank you so much. Yes, thank you. Thank you so much, and God bless you. Have a lovely year. I wish you a happy and a prosperous new year. Until I come your way again, take care of yourselves and God bless you. See you in 2021. Bye. God bless you all.